We appreciate the work the coroner has done in reviewing these tragic deaths. We have complied fully with his office since the fall, and we commit to moving forward immediately in response to Dr. Skinner's recommendations. We are committed to maximizing student safety and success at Queen's. That's why we are actively engaged in strengthening the programs and processes in place related to alcohol consumption and personal safety, including a review of the campus alcohol policy. Like other universities across North America, we are wrestling with the societal issue of alcohol consumption and excessive drinking in the student-aged population. Queen's, like other universities, encourages safe and responsible decision-making and good citizenship and discourages underage drinking. We expect students to adhere to our code of conduct and community standards in residence. Our approach is one of harm reduction. We've been proactively addressing this issue for several years and will continue to do so.
Was alcohol involved in the deaths of Habib Khan and Cameron Bruce?
That is a question that is more properly addressed to the coroner. The coroner has ruled the two deaths accidental. He has, however, made recommendations which relate to alcohol, and it's those that we're fundamentally concerned with today.
Are there legal obligations to follow the coroner's report?
Are there legal obligations?
Yes.
Well, I will turn that over to the AVP's peers.
I don't think there are direct legal obligations. However, the coroner's made it clear that he wishes to check back with us in a period of about 6 to 8 months to see what kind of progress we've made in regards to these recommendations.
How much involvement has there been with students at large in decision to take away or change how safety and health issues are dealt with, which have formerly been dealt with through like student and peer-led judiciary model? Like how much engagement or like involvement has there been with students at large?
Well, first of all, there are no decisions have been made about anything. What we have had for some months is a reinvigorated and newly remandated alcohol working group. And again, Dr. Pierce can give more details of that, but as I said earlier, all of these issues will involve the AMS as our partners with, again, safety as the highest concern.
What I could say is that the alcohol working group and the campus safety working group involve representatives from administration, some faculty members and students. And what we've been doing is discussing the different judicial systems across campus and looking at the way they work to see that students are treated fairly across all of those entities. And so there's been a kind of basic review that's been undertaken to ensure that the processes work well, that they're appropriate, and that they give even-handed sanctions to any infractions against the student code of conduct.
There's actually been an alcohol working group stuck underneath the Health and Wellness Committee module that's been set up by Student Affairs. So we've been working with that committee for some time now, and we're doing a full review of all the different jurisdictions that have different discipline systems that fall underneath them. So Athletics and Recreation, for example, has one for any transgressions that happen while an athlete is involved in a campus sport. There's also another one for residence life for transgressions that happen while within the residential system. And then we have the non-academic discipline system, which has been around since 1898, reports to Senate, and deals with all of the transgressions that happen by students while they're here at Queen's. So we're doing a full review to see how the different discipline systems interact with each other to make sure that they're all compatible and that they have similar infractions and reprimands for similar kinds of actions. I think the report has a lot of recommendations that will help improve health and safety measures on campus, but in terms of how the reports and recommendations will be implemented, that comes down really to the university and to the student government and basically the Queen's community as a whole. So we'll be looking to do a review of how the recommendations can best be implemented at Queen's, and we're looking forward to having some good progress on that by the end of the summer months. Binge drinking is a growing issue among our demographic. We do a lot at Queen's already that's peer-to-peer administered, so I think we're in a good place to start leading a student movement to address the drinking culture at Queen's. Some of the things that we do that are peer-on-peer, we've got a full student constable service that's fully fully licensed and trained to deal with alcohol infractions. We also have the campus observation room, which is completely supported by students. And we have full training for alcohol intervention by all of our staff at all our campus pubs. So we do have a lot of different ways that students are involved in leading this initiative, and I think we're looking at furthering the student level of engagement in dealing with this important issue.